Hi, and welcome to another episode of We Are In This Together, the Red Cross in the Caribbean show, talking about how to stay safe and healthy during COVID-19. I'm Angela Hill. I host our weekly-ish show. Sometimes we miss a week, but we are here, and we've been here since April to just talk about staying safe and healthy throughout this pandemic. I'll tell you this now, and I'll remind you at the end again, we always look for your feedback. So if you have questions or comments, you can leave them wherever you're watching this. And it helps us shape the next conversations we have. This week, we're talking about the impact of COVID-19 in older adults. And joining me to do this is Andrea, who works in mental health and PSS, psychosocial support with the Red Cross. Thanks so much for joining us, Andrea.
Yeah, thank you, Angela, for having me. And it's a pleasure to be here today.
Awesome. So maybe just to start, tell us a little bit about your role and your work with psychosocial support overall.
Sure. I am a delegate of mental health and psychosocial support, working in the regional office for the Americas, the Panama office, in the health unit, and part of the mental health and psychosocial support technical core unit. And yeah, I've been doing this since mid-July, and with the Swedish Red Cross, which is my national society supporting, I will continue to work until the end of this year.
Wow, that's great. Well, thank you so much for your support in this area. Today, as I mentioned, we're going to talk about older adults and the elderly and the impact of COVID on them. So maybe if you could just start by talking a little bit about what kind of vulnerabilities older adults have or why we should be thinking about them in a different way.
Sure. Yeah, we know that, and we have seen that this pandemic has affected many people worldwide, millions, and a lot of the people who have been affected are the older persons. Actually, we've heard and we've read recently that the coronavirus disease has already been identified as a geriatric health emergency because of the highest rates of deaths and affected people that are older adults. And we know that it carries an increased risk for other underlying medical conditions that might also increase vulnerability to and impair the recovery from COVID-19. But we also have seen the secondary effects, that have been present for all of us. But for the individuals over the age of 60, this can be uniquely even worse because of the social distancing. People who are older might be living alone. They might be experiencing the impact of loneliness. And we need to take into consideration all these secondary impacts that this crisis has already shown its effects, and we have already studies talking about this for this population.
And when you talk about things like the secondary effects or they might be experiencing loneliness, like what does that look like, or how does that come across to someone who might have an older adult in their life or be working with them? Like what would they see in another person?
So self-isolation is one of the measures that has been suggested and has been reinforced from governments worldwide as a measure to avoid spreading of the virus. But we, as I was saying, we will disproportionately see how it's affecting the elderly individuals whose only social contact sometimes is out of the home. So it could be daycare venues, community centers, places of worship, and all these opportunities for these people might have been closed down because of these measures of quarantine and self-isolation. So those who do not have close family or friends and rely also on the support of voluntary services or social care could be placed at additional risk, along with those who are already lonely, isolated, or secluded. So as you can imagine, experiences of loneliness, and we know this in general from the general population, can also lead to other negative emotional and psychological impacts, like, for example, an increase on anxiety, depression symptoms, and even for older adults living with cognitive disorders or dementia, increasing their risk for cognitive impairments during this period.
Wow. So, I mean, obviously, we are asking people to stay socially or physically distant, not socially distant. So, what are some of the things that people could do if they are an older adult to stay healthy, or if they have an older adult in their life? How do they support them?
Yeah, so I think, and we have seen studies that have come recently suggesting that physical activity and exercise are one of the most effective therapies, working preventively, but also as a therapy for all types of chronic diseases. It has direct effects not only on physical but also on mental health. In fact, exercise has been considered the real polypill based on epidemiological evidence of its preventive and therapeutic benefits. And considering the main biological mediators involved that are very well known, it's no doubt that it can be a really good way to support the older persons. We also want to remind people that social distancing and that physical distancing doesn't have to be social distancing, no? So the National Societies of the Red Cross volunteers, but family members should also pay a bit more attention to keeping their loved ones, the older persons, in closer contact, in communication, using any media that they might have, even increasing telephone calls during this period if they cannot visit. Also taking into consideration the different limitations, literacy, internet use that the elder persons might have. So we should really adjust the way we communicate to the level and knowledge and skills, technological skills that older persons might have. And I think that when lockdown and quarantines measures are being loosened, we should really encourage the older persons to go out, to walk, to do physical activity. But for this, we have to also take into consideration the fear as a factor that could prevent people of this age to go out and socialize or even go out for individual physical activity because of all the media, of all the many times confusing information that is coming in. People might be very afraid, and this could prevent them. So another way to support them is to ensure that they receive valid and accurate information about the situation, about ways of protecting themselves. We can help them by giving them the tools, the personal prevention tools they would need to protect themselves, and at the same time continue doing their routine daily activities they have to do to keep themselves active.
That's really, really good advice. I know you're speaking more to this, and I think you have a seminar coming up for the public on this. Can you speak a little bit more about the information they can get on that?
Sure. This is an open public event that we are organizing with colleagues from PGI, and it will take place on the day of for the International Day for dedicated to older persons. We will be discussing all these things, how this crisis has impacted the older persons and how we can support them, because it's really important to remember that the older persons are not just a vulnerable group, but it's an important social capital, and they bring in perspective, wisdom. They have experienced so much that can actually support us, the younger generations, with their knowledge and their and all this information they have, their wisdom. So we are going to be talking about ways to support them, but also ways to involve them. I think one of the best ways to have people feeling increasing their self-esteem and having self-worth is by giving them the opportunity to give back, to share their knowledge, to share their skills, and to support others. So I think my colleagues from PGI will be also talking a lot about how to involve older persons in the efforts to beat this pandemic and keep ourselves healthier. We will also be sharing, and we have invited national societies that have been actively involved in activities with older persons. That will be Trinidad and Tobago and also Costa Rica, that they will be sharing their experience in conducting such activities with older persons. So we are really excited. I hope there will be a lot of participation, and it's on the October 1st, so in a week from now, and we can share the link and information about that event with everyone.
Exactly. In the comment section, if you're watching on Facebook or on YouTube, we'll get the information on there, and we'll also share it through Twitter. So if you are interested, you'll have the information to sign up. You mentioned many national societies are working with older people as part of their outreach. Can you tell me some of the things or activities you've heard that you see is working quite well?
Right. So as I said, there are many different activities. I will just mention a few that I've heard of so far. So we know that some national societies are doing home visits and accompanying older persons to healthcare checkups, to visits to their doctors. They're also providing material and food distribution in their homes, so that persons that could not go out or they didn't have family members to support them could get the necessary and cover their basic needs. Many national societies have established helplines and to
Oh, I think you froze on
provide
us.
social support. And from what I heard, many of the people that have reached out are older people that were really challenged by the feelings of loneliness. And it is great that the national societies are there behind the lines to listen and to provide PFA to these people.
Absolutely. And I think you really sort of hit the nail of how we are responding to COVID-19 on the head when you talk about people, empowering people to look after themselves, but also looking out for each other, right? Because that's our whole message around how to be safe and healthy during COVID-19 is we're in this together, right? So while we're empowered and empowering others, we are looking out for each other.
Exactly.
I really, really appreciate your insights into working with older adults in this time. Do you have anything else you want to add at this point?
Well, just what you were saying, that we need to take care of each other. And unfortunately, in some places of the world, the older persons have been neglected. No, they have been left aside. This always happens, even without crisis. So I think that we need to remember that the older persons do not only have specific needs related to their age or underlying medical conditions, but they have so much wisdom, they have so many skills, they can give us a lot of support, a lot of love and care. And we should always try to include them and reach out to them, not only to help them, but to receive help and support from them. So I think inclusion is a key, and caring, of course, for each other is part of our priorities.
Absolutely. We are in this together. Thank you so much for joining us today, Andrea. I really appreciate it. To those of you who are watching, thank you for your comments. As always, Hannah tells us it's very interesting. We love to hear from you. We want to get your questions, your comments, your feedbacks, what you're hearing, what you want clarified. This program is here to help us all have a better understanding of how we can get through this together. We are in this together. That's the name of the program. I'm Angela Hill. I'll be back next week with another show. And until then, stay safe and healthy. Thanks so much. Bye.
Thank you.